Hi, my name is Jaden. Today I'll be presenting the nutrition care process for Susan Bowers, a 55-year-old female who was admitted after experiencing an acute ST elevation myocardial infarction and receiving a cardiac catheterization with placement of a stent in the left anterior descending artery. For Susan's nutrition assessment, I would collect information related to her cardiovascular health, medical history, dietary habits, and lifestyle. Important information includes her history of hypertension, hyperlipidemia, osteoarthritis, current medications, lab values, weight history, and dietary intake. Susan is 64 inches tall and weighs 173 pounds, giving her a BMI of approximately 29.7. Additional assessment information includes her lipid levels, blood glucose, kidney function, and any changes in appetite or eating habits after hospitalization. I would also assess her typical intake of sodium, saturated fat, fruits, vegetables, fiber, and alcohol. Since Susan follows a kosher diet when possible and identifies as Jewish, it is important to understand her food preferences and cultural practices before making recommendations. Based on the assessment findings, an appropriate nutrition diagnosis is excessive sodium intake related to dietary patterns contributing to cardiovascular disease risk as evidenced by a history of hypertension, hyperlipidemia, and recent acute myocardial infarction requiring cardiac catheterization and stent placement. For Susan's nutrition intervention, the goal is to support heart health, reduce further cardiovascular risk, and promote recovery after her myocardial infarction. Her nutrition prescription will focus on a heart-healthy eating pattern, and recommendations include limiting sodium intake to less than 2,100 milligrams per day, reducing saturated fat, increasing fiber intake, choosing lean proteins, and increasing fruits, vegetables, and whole grains. Susan should also choose healthier fats such as olive oil, nuts, and avocado while limiting highly processed foods. My on-screen nutrition infographic would show a heart-healthy plate. The graphic would include half of the plate filled with vegetables and fruits, 1/4 with whole grains, and 1/4 with lean protein. It would also include reminders to reduce sodium, choose healthy fats, and drink water. Cultural competence is an important part of Susan's nutrition care. Because Susan follows kosher dietary practices, recommendations should include foods that align with her beliefs and lifestyle rather than suggesting foods that may not be acceptable to her. For example, heart-healthy kosher options may include fish, legumes, vegetables, whole grains, and kosher certified lean proteins. Addressing cultural preferences and possible barriers to accessing healthy foods supports health equity by making nutrition recommendations realistic and achievable. For nutrition monitoring, I would evaluate Susan's process by monitoring her blood pressure, lipid levels, weight changes, dietary intake, and ability to follow heart-healthy recommendations. I would also assess her understanding of sodium reduction and her ability to identify healthier food choices. Continued nutrition follow-up will allow adjustments to her care plan based on her recovery, preferences, and individual needs. Providing personalized nutrition education can help Susan reduce her cardiovascular risk while supporting her cultural values and overall quality of life.